Can doctors replace the damaged skin of your face? Hi, I'm Dr. Suresh, Senior Consultant, Facial Surgeon, Gnathos Face. Many conditions like accidents, injuries to the face, or some tumors, some portion of the facial skin is lost. We call it as facial skin defects. Now, how are we going to treat? Using a simple solution called as skin grafts. Skin graft is not just a patch of other skin which is applied to the face. There are technically some conditions to be taken into consideration, especially when you are applying skin grafts over the face. There are two types of skin grafts. One is split thickness skin graft, where a portion of your facial skin is lost that can be replaced by the split thickness skin graft. Even the larger defects of your facial skin is covered with the split thickness grafts. If the defect is small but the depth of the defect is huge, then we use other type of skin graft called as full thickness skin grafts. The modern science has got up some more advances where instead of taking a skin from a other side of a patient, we are using an artificial skin grafts called as bio-collagen grafts. This also helps the recovery just like your skin graft. The advantage is we are not taking a skin from other side, those thereby the pain is minimized. The biggest challenge when you are applying skin grafts to the face is the color match. You have to match the existing color of the face with the new graft. That is where the graft donor site or the biocollagens have a best results where the color match can be easily achieved. What are the challenges in recovery after a skin graft? There are three phases of it. The first phase is from the day of surgery to the 7 days. This is the stage where the skin is adapted to your body and your body starts accepting that new skin. That is where a condition called as hematoma is formed, so the graft rejection can happen. In first 7 days, we have to minimize the chances of hematoma formation underneath the graft, thereby the success of graft is increased. The second stage is from day of 7 to 14 days, where the chances of infections are high. So you have to take care of the wound management so that the infection doesn't occur and the skin graft is taken well adapted by the body. The third phase is from day 14 to 1 month. This is the time where your skin graft adapts to the body and the new skin starts accepting it. That's the time when you have a contractures of the graft, thereby the muscles of the face movements or the jaw movements are affected. During this stage, we need to activate the skin graft so that the contracture doesn't happen. The most important is, especially when you are applying skin graft to the external surface of the face, the sun protection. We use a special creams called as ultraviolet protection creams so that there is no graft mismatch between your other facial skin and the graft skin. Ultimately, the new skin graft should absolutely blend with your existing facial skin, thereby the overall the function, cosmetic and the satisfaction of the patient is achieved. If you find this information valuable, please share it with the people who are in need of it. Thank you for watching this video.